Health checkups seniors should rethink after 70. As we age, keeping track of our health becomes more important, but not all routine medical tests are beneficial after 70. Surprisingly, some commonly recommended exams may do more harm than good. Every year, millions of older adults line up for checkups believing they are preventing disease. Yet research shows many tests in seniors can lead to unnecessary treatments, side effects, or complications. Most seniors are unaware of these risks. Let's begin with number 5, bone density scans, also called DEXA scans. This test measures bone strength and identifies osteoporosis risk. On the surface, it seems simple and painless, a quick scan to check for fractures. However, after age 70, mild bone loss is often a normal part of aging. Many seniors are prescribed medications like bisphosphonates after a low-density reading. These drugs can cause significant side effects, such as jawbone deterioration or irritation in the esophagus. Studies show that for older adults, treating mild bone loss with medication has minimal effect on actual fracture prevention. For example, a study in the Journal of the American Geriatric Society followed over 1,200 women aged 70+ and found that bisphosphonates reduced fracture risk by just 0.3% over 5 years, while side effects were common. Consider Rose, a 76-year-old retired piano teacher. She had no history of falls, but her DEXA scan showed mild osteopenia. She was prescribed medication, which caused reflux and jaw pain, preventing her from playing piano. When she switched to vitamin D, weight-bearing exercises, and a calcium-rich diet, her strength and balance improved and she avoided fractures. Lifestyle strategies, resistance training, proper nutrition, and vitamin supplementation can reduce fracture risk by over 20% and are often safer than medication for many seniors. Next is number 4, brain MRIs for mild memory loss. Forgetfulness is common with aging, and it's natural to worry about dementia or Alzheimer's. Doctors may order an MRI, but most scans in older adults show harmless age-related changes like small white matter spots or mild shrinkage. A 2021 study in Neurology Today examined 3,000 MRIs of adults aged 70 to 85 with minor memory concerns. 86% showed some abnormalities, yet only 3% were linked to treatable conditions. The rest caused unnecessary worry and sometimes led to invasive procedures. George, a 74-year-old retiree, experienced panic after seeing his MRI results, even though cognitive tests confirmed normal function. By focusing on lifestyle adjustments such as sleep, hydration, and mental exercises, his memory stabilized without invasive treatments. The key takeaway: unless severe neurological symptoms exist, such as seizures or rapid functional decline, brain MRIs are rarely necessary for mild memory issues. Simple cognitive tests and lifestyle interventions are usually safer and just as effective. Moving on, number 3 is the cardiac stress test. It's often prescribed when seniors experience mild fatigue, occasional chest tightness, or feel less energetic. Stress tests monitor the heart during exercise or via medication that simulates exertion to detect potential blockages. For seniors over 70, however, stress tests often lead to more harm than good. False positives are common, sometimes affecting 40% of older adults. These results can prompt unnecessary procedures, including stent placement or bypass surgery. Such interventions carry risks like bleeding, kidney damage from contrast dye, and longer hospital stays. Raymond, a 75-year-old retired postman, underwent a stress test after mild fatigue on hills. The results were unclear, so he had a catheterization. A minor narrowing was found and a stent was placed. Unfortunately, he experienced kidney complications from the contrast dye and spent 6 days hospitalized. His fatigue persisted because it wasn't related to heart disease. Safer alternatives include resting EKGs, which track heart rhythm at rest, or coronary calcium scans, low radiation imaging tests that show plaque buildup. Number 2. Colonoscopies. After 70, and especially beyond 75, routine colonoscopies can be riskier than beneficial unless symptoms are present. Preparation involves strong laxatives, which can cause dehydration, dizziness, or kidney stress. Sedation adds additional risks. The procedure itself can sometimes cause bleeding, perforation, or even heart rhythm problems. A 2019 JAMA internal medicine study followed over 1.3 million patients over 70. For every 1,000 colonoscopies in those over 75, only 2 lives were saved, while over 20 patients experienced serious complications. Stool-based tests, like the FIT test, are safer alternatives. They're non-invasive, require no sedation, and catch most concerning cases. Seniors should discuss options with their doctor to avoid unnecessary risk. Finally, number 1. Full-body CT scans. These scans are often promoted as preventative in private health packages, promising early detection of cancer. However, for adults over 70, the risks often outweigh the benefits. Full-body CT scans expose patients to high levels of ionizing radiation, around 10 to 20 millisieverts per scan, equivalent to 500 chest X-rays. Over time, this can increase the risk of cancer. Studies estimate that these scans may account for up to 5% of all cancers in the U.S. CT scans frequently detect harmless findings, such as tiny nodules, cysts, or calcifications. Once these are discovered, patients often undergo more imaging, biopsies, or even surgery, causing unnecessary anxiety and complications. Marcus, an 80-year-old martial arts instructor, underwent a full-body scan as part of a private package. A 3-millimeter lung nodule led to a PET scan and needle biopsy. The result was benign, but he suffered a collapsed lung and spent 2 months recovering. Experts agree that full-body CT scans are not suitable for general screening in asymptomatic seniors. Targeted imaging is appropriate only if there are clear symptoms, such as unexplained weight loss, blood in stool, persistent cough, or visible swelling. In conclusion, the 5 tests seniors should evaluate carefully are bone density scans, DEXA, brain MRIs for mild memory loss, cardiac stress tests, colonoscopies, full-body CT scans. Modern medicine is powerful, but not infallible. After 70, it's often safer to focus on lifestyle. Stay active, eat a balanced diet, sleep well, and choose tests wisely. Ask your doctor what happens next if something is found, and avoid fear-driven screenings that could cause more harm than benefit.